think we will start. Good morning, everyone. My name is Vithoulkas, and I work for the sport team for our company. And we would like to welcome you to today's seminar. What we will be discussing today, Dr. Lefteris Tapakis, our head of homeopathics, will be going through and show you how to take the most advantage of the Vithoulkas Compass. And he will show you a few features that will help you to repertoirize and show you the most important features of the Vithoulkas Compass. And I would like, before we start, I would like just to inform you that if you need any help or if you have any questions or any difficulties with the program, you can contact us directly to by sending us email to info@vithoulkascompass.com or support@vithoulkascompass.com. And normally we respond to the emails within 24 hours. After the seminars, I will send all our details to Dr. Chabanov, and he will be able to forward it to you. So if you need anything, you will have our contact details, Viber, WhatsApp, so we can have our communication immediately. So you can contact us on Viber or WhatsApp. And I don't want to waste the time because I believe Dr. Lefteris Tapakis has most important things to discuss with you. So I will pass on to Lefteris Tapakis, to Dr. Lefteris Tapakis, but he will discuss with you about the features of Vithoulkas Compass. Thank you so much for attending this session today. Lefteri, please.
Thank you. Thank you. Welcome, everyone. I'm Dr. Lefteris Tapakis. I'm a student of Professor Vithoulkas since 2002. And I will be happy today to introduce you to the program Vithoulkas Compass. I guess that you are new in homeopathy. So I will try to show also some basic features as well as more advanced features. I don't know if you all understand my language. I will try to speak slowly. And also, if not everybody understands English, you can translate. If there is the possibility, you can tell me. So let us begin by sharing my screen. So this is the program, Vithoulkas Compass. I think most of you must have seen it before. When you log in, you can see this page where there is some news here. This section, by clicking here, is My Cases. This section here is the Materia Medica. And this section here is the repertoire. Okay, let us begin with the repertoire to show you what you can do. I guess you all know what is the repertoire, huh? We have the Materia Medica, where the Materia Medica is a remedy with the symptoms, like you see here, a remedy, Ambrotanum. You see the description of Ambrotanum and all the remedies, and the repertory is the index to these symptoms. Already from the time of Hahnemann, that we had only 60 remedies, there was the need for an index, because you cannot remember all the symptoms of all the remedies. You know, aconitum has fear of death, has fear of closed places, has panic attacks. But how many other remedies have fear of death? You have to remember that I have learned the fear of death in arsenicum, I have learned fear of death in aconitum and in some other remedies, but you cannot remember all the remedies that have a specific symptom. So we have aids, we have helpers, and such a helper is the repertory. You know, this book, this is Ken's repertory, which help us to find which remedies have a specific symptom. As I said, the first repertory, the first index was already prepared by Hahnemann. It was like the second part of his Materia Medica, and it's called Fragmenta de Biribus. It was an index to the first remedies. And then Wenninghausen, a student of Hahnemann, made the repertory as we know it today, with the index, with its the remedies with their gradings in each symptom, and the point of in history of homeopathy of the repertories is Ken's repertory, that was made in 1910, if I remember well, and still Ken's repertory is the basis of the modern repertories. And also Vithoulkas Compass repertory was based on Ken's repertory, with some additions from classical authors and additions from Professor Vithoulkas. So this is the first chapters of the repertory. The repertory has 37 chapters, and in each chapters we have some symptoms that are in the same theme of each chapter. For example, we have mind chapter, in which we have mental and emotional symptoms, like we have anger, we have pathologies that are related to mental conditions, like anorexia nervosa. We have biting. Biting is it's not in the mouth, like you go to the face chapter, but because it is something that originates from the mental sphere, it is in mind, biting. And if you go to the sub-rubrics, you see biting objects, biting people, biting fingers. It means that the person bites its own fingers, etc. Each symptom in the repertory has some remedies, of course. Okay. And these remedies are in a grading. What does this mean? This means that not all the remedies in a symptom have the same importance. For example, here, biting, when you hear biting, your mind goes to stramonium, to belladonna, to licinum. These are the most frequent remedies that we see this symptom. Biting nails. You see here 23 remedies, but the main remedies are these with red. This is in the 3rd degree. We have the 1st degree that we have the remedies in normal fonts. We have the blue and italics, which are in the 2nd degree. And we have the bold and the red that they are in the 3rd degree. The higher the degree, the higher the relation of the symptom to the remedy. And these are the first remedies that one thinks if we hear this symptom. Now, if the symptom is small, what the rubric is small. Small means that a rubric has only a few remedies. Each remedy is important. So, in biting hands, you see here 2 remedies. Biting himself, you see here 9 remedies. Every remedy is important. So, if you see a small rubric, you have to see all the remedies. If you see a larger rubric, like fear, here your mind should go to the bold remedies, to the higher degree. Okay, so if you see a large rubric, you see only the remedies that pop up with a higher degree. If you see a small rubric, you have to take account all the remedies. And it is important to have a familiarity to the repertoire. That means that I propose that you should buy a repertoire also in a book, Ken's Repertoire, and see in the book which kind of symptoms are in each chapter, to see what are the general symptoms, for example, generalities. What kind of symptoms do we find in this chapter? Does anyone know? Do you want to tell me what kind of symptoms are there in the generalities? Okay, never mind. It's okay. So in the generalities, you can find modalities. What are modalities mean? Modalities mean a condition that make the patient better or worse. For example, bathing aggravates, and this amel, you will see it frequently in the repertoire. Ag means aggravate, means a condition that makes the patient worse, or the symptom in which the rubric describes worse. Bathing aggravates. Bathing aggravates, it means that the person, after having a bath, is worse. And the first symptom in this, the first remedy in this symptom is sulfur, of course, but you have also other remedies, ammonium carbonicum, antimonium, crutum, calcarea carbonica, calcarea sulfurica, clematis, rastox, sepia, etc. Each remedy in this may be worse for different reasons. For example, sulfur may be worse from bathing because it may have itching or a specific condition that gets worse. Rustox may be worse because Rustox is a remedy that is worse in wet weather and from water in general. Also, it's a cold remedy, so it may be worse because it gets cold and because the ligaments, his body feels worse. So each remedy may be worse for different reasons, and each remedy has its own response to a specific factor. Here we see bathing ameliorates. The opposite symptom, bathing aggravates, bathing ameliorates. You have asarum and pulsatilla. Pulsatilla is a warm remedy and is better by bathing, perhaps because it gets more cool and he likes this falling of the temperature. So again here, each remedy has its own color. So generalities chapter have these modalities, these general modalities that are very important and correspond to the whole organism. Okay. So we have the generalities. Also, we have the modalities in the generalities. Another theme, another subject in the generalities are some pathologies. For example, cancerous affections. Here we see a condition or a disease, and you see again the remedies. So for cancer, we have 97 remedies. Of course, that does not mean that you will have cancer and you will give conium. All you will necessarily give one of these remedies. You will take it as a symptom and prescribed as usual with the totality of the symptoms. And what homeopathy can do in cancer, this is another story in general, but it depends on the levels of health, it depends on the stage of cancer. But if the remedy is correct, it will help to a certain degree. Okay. So we have also this rubric, cancerous affection. Let's find another pathology. I'm going down the general chapter of the repertoire, and I see here diabetes, diabetes mellitus. So this is another pathology that we see here. Also some remedies, 82 remedies. Natrium sulfuricum is the first remedy for this condition, and also some other remedies. So one theme in the generalities is the modalities. Another theme is the pathology. And another big theme in the generalities section is the food and drinks. Food and drinks in homeopathy, and this was one of the first things that made an impression of me when I finished medical school, and I knew nothing about homeopathy. A friend of me was telling me, go to this doctor, he practices homeopathy, and go to see what he does. Okay, and I went there after I had my doubts, but I went there to see. And I saw the first interview that that I was attending to, and this guy came because he had sinusitis, and he asked him about sinusitis, and then he was asking, what do you like about foods? You like pasta, you like meat, you don't like cheese. And I was thinking of what nonsense does this doctor ask? This guy has his nose, his sinusitis, and he's asking him about fruits and about salt and about lemons. But I learned afterwards that these are symptoms that are necessary for the organ for us homeopaths to prescribe, because we have connected specific remedies to specific desires and aversions. And of course, every desire and aversion has, even if we don't know why the organism needs aubergines, there is a reason for this. For example, we know that Calcarea carbonica likes soft-boiled eggs. This is because most probably the organism needs calcium, and from eggs can absorb this calcium, and in particular from soft-boiled eggs can absorb the calcium more easily. We don't know, of course, for every desired aversion, why does this happen. For example, we know that Ignatia has an aversion to fruits. When I don't know if you have thought about the remedy Ignatia. Ignatia, it's a remedy that we give after a grief, when a person has a grief and feels sad and signs and feels a lump in the throat, and this person gets to have an aversion to fruits. Maybe before the grief he could eat fruit, and after the grief we see that he is not interested about fruits. Why? We don't know, but we know as observers that we have connected this symptom with Ignatia, and we have seen that after giving Ignatia and after Ignatia acts and relieves this grief, the person again gains this desire for fruits. After 1 month, you can see that he can eat again fruits. And this symptom, which one may say it is of no importance, becomes very important for a homeopath, because it becomes a keynote. It connects the grief with the lump of the throat, with the aversion of fruits, 1, 2, 3 symptoms, and with 3 symptoms, he thinks this person needs Ignatia. He gives the Ignatia, and you see a curative action. Okay, so a large percentage of generality is food and drinks. Food and drinks, desires and aversion originally in Ken's repertory was in chapter stomach, but in the modern repertories, you mostly see it in the chapter generalities in the food and drinks. Okay, so food and drinks, you see the symptoms in alphabetical order. Let's go here. Butter, aggravate, desire, aversion, huh? And you see with this button here each symptom and what remedies are in each symptom. We know aversion to butter, the first remedy is pulsatilla. We also here see here China, huh? Aggravate, pulsatilla. So pulsatilla may have it. You see here. Let's see here what is happening. You see, desire butter, pulsatilla. Aversion butter, pulsatilla. Aggravate butter, pulsatilla. Do you know why is this? What does a person who needs pulsatilla have? Has a desire of butter, aversion, or aggravate? Does anyone know why we can see pulsatilla in both these opposite symptoms? It is a matter of a percentage. Pulsatilla has a connection with butter. Most pulsatillas, that means most person that need pulsatilla, may have an aversion to butter. I don't know about percentage, but let's say 60% or 50% of people who need pulsatilla have an aversion to butter. But 10% of people that need pulsatilla may have desire for butter. One, of course, cannot have desire and aversion at the same time, okay? So a smaller percentage have a desire, a larger percentage have an aversion, and these two symptoms may come together, like a person that has an aversion to pulsatilla, to butter, may also have aggravate from butter. That means he does not like butter, but if he eats butter, he is worse. His stomach is worse. He cannot digest butter. And there is also the possibility that these two symptoms go together, like one desires butter, but after he eats butter, he's again worse. Okay. Do you know another remedy that has a desire for something and after he eats it, he's worse? There is a remedy that likes very much sweets, but sweets aggravate him. Does anyone know what is this remedy? Sweets. Desire sweets. So many remedies. Argentum nitricum, calcarea, china, lycopodium, phosphorus, sulfur. And a remedy has also desire and aggravate at the same time. This remedy is argentum nitricum. Argentum nitricum has a desire for sweets, but after he eats a lot of sweets, he has some symptoms from the stomach. And with this combination, we think of Argentum nitricum. Of course, not all Argentum nitricum persons have this combination, but if you see this combination, you have think of this remedy. Okay. Tell me a remedy that you have done so that we can see it through the repertoire. A remedy that you have taught that you have seen until now, so we can see it. Do you understand what I'm saying? A remedy, tell me a remedy that you have heard of, that you have done in the learning, in your lessons. Have you learned about arsenicum? Yes, arsenic. Okay, let's see. I will show you something, how you can see here the symptoms of arsenicum. So you have the repertoire. Before arsenicum, I will show you how you search the repertoire. Okay. If I want to search for a symptom, one way to do it is to browse the repertoire. That means I go mind. I want to see, let's say, fear of death. Okay. With the mind, I go alphabetically to fear. Despair. You see all the symptoms here: disappointment, mental symptoms. Envy. Fear. I click fear. And here, in the beginning of each, we have the day of time, fear mostly in the morning, in the noon, in the afternoon, in the evening. And then we go alphabetically, fear of being alone, of animals, of being arrested, of birds, of cats, of cancer. Let's go fear of cancer. Here, in this rubric, we have 27 remedies, fear of cancer, and we have 4 gradings, 4 degrees. This bold and black is agaricus. Do you know agaricus? Yes. Agaricus is the remedy with the most intense fear of cancer. Then we have other remedies. So this is in the 4th degree. We have other remedies in the 3rd degree: calcarea, nitric acid, platina, psorinum. Then we have remedies in the 2nd degree: arsenicum, kali aceticum, kali arsenicum, lobelia, lycopodium, sulfur. And then we have remedies in the 1st degree. So one way to find this rubric is to go step by step. And this way you'll go in the book also. You go first chapter mind, then you go fear, and fear alphabetically to cancer to see the remedies of fear of cancer. Another way is to just write here fear of cancer. Okay, fear cancer. And you see the remedies of fear of cancer. And you see here arsenic. Now, so this is the one way. You don't have to know where in the repertory you can find, in which chapter you can find the symptom. Let's say uncover feet. Does anyone know in which chapter will I find it? Which chapter? Generalities, mind, vertigo, mouth, cough. Which chapter will I find uncover feet? This symptom, you will find it in the extremities, huh? But even if you don't know where to find it, you write here uncover feet, and you see that all the rubrics that have these words uncover feet come up. So you see here extremities, uncover, inclination to feet, pulsatilla, sulfur, amomilla, mendorinum, sanguinaria. Inclination to uncover feet means it has the inclination, the desire to uncover the feet. Extremities, heat, foot burning uncovers them, means that now he uncovers the feet, sulfur, mendorinum, more or less the same remedies. So this is the one, the most easy way. You just type one or two words from the rubric, from the symptom that you want to find, and you find it. So we see here, let's go to desire again, salt. Do you know a remedy that has a desire for salt? We go here, desire for salt. Natrium muriaticum, the first remedy. Argentum nitricum, lacaninum, phosphorus, etc. So you don't have to go step by step. Generalities, food and drink, salt. You just type desire salt and you can find it. So let's see another possibility of the repertory. Let's say that I want to see the fears of a specific remedy, like the fears of arsenicum, okay? Or all the symptoms of arsenicum. Let us begin with it. Arsenicum, I write arsenicum album, you see all the remedies here. I click search. And in this way, now you are going to see all the symptoms of arsenicum album. Something with the internet. Okay. So all the symptoms of arsenicum album. You see, arsenicum album, 6,449 rubrics in the repertory. It is one of our polychrists, as we say. That means that that is one of the remedies that it is represented well in the repertory. That means that it has a lot of symptoms in the repertory. 600, more than 6,000 symptoms. And you see now the symptoms of arsenicum in the 4th degree. That means in the highest degree that we can find. Censorious, fastidious, fear of death, stomach, thirst, small quantities, often. You know what this symptom means? This means that arsenicum has thirst, but specifically for small quantities. That means it drinks, it takes water, drinks, one sip, little water. Then after half a minute, again. And this does it often. Desire for small quantities and often. Okay, this is one of the keynotes of arsenicum, especially in acute diseases or in anxiety. You see one sip down, again one sip down. This is a characteristic of arsenicum. Okay. Another symptom is anxiety in the midnight from 1 to 2. Food poisoning. You see symptoms from different parts of the repertoire and of different meaning that all are connected to this remedy. Anguish, anxiety. Now, let's see something else. Let's see where in the repertoire arsenicum is the only remedy in the rubric. You see here rubric size, min, max. I click here 1. I click search. I wait. And I see in, you see many rubrics, in 449 rubrics in the repertoire, arsenicum is alone. That means it's like a keynote, it's a characteristic, it's only this remedy. And you see the aggravation from 1 to 2 after midnight. Anguish, driving from place to place. Arsenicum has restlessness, has anxiety. Anguish means more than anxiety, stronger anxiety, and he goes from one place to another. Arsenicum. Frighten easily, night, waking on 3. That's fine. Bluish aphae, strange symptom. You know, the aphae is these blisters that there are in the mouth, and what is their color? What is the color of the aphae? In most of the times it is white, and if it is blue or bluish, we think of arsenicum. Anxiety, night, on rising up. And with this way, you learn also, because you browse into the repertoire, you see, you put the remedy. Let me see here, today I have learned about arsenicum. What are the delusions of arsenicum? Let us see. Delusions. Mind delusions. This is delusions is a great chapter in mind, where I suggest that in every remedy that you learn, go and see the delusions or the fears of the remedy. You'll understand better the essence and the psychopathology of the remedy. You see, arsenicum is a remedy that has insecurity, that fears of thieves, that is afraid. He's very much materialistic. He wants to, he's afraid of his property of getting lost, of robbers. And this fear is so intense that he may also seize robbers in the house, like delusions, thieves, robbers seize in the night. Okay. He imagines robbers in his house. Mind illusions people beside him doing as he does. It means that he imagines someone that is next to him and he does what he does. Okay, he imitates him. Strange symptoms, huh? Rare symptoms. But these symptoms sometimes help us understand about the mentality of the symptoms. Let us see another delusion. Delusions, friends, has lost the affection of offended. That means that he imagines that he has offended, not the real offense, but an imagination. And with this way, you can search the food and drinks. What does arsenicum likes or dislike? Okay, food and drinks, arsenicum. Here I have where it is the only rubric because I put here one, but let us see all the desires and aversion of arsenicum: alcohol, cold drinks, fruit aggravate, let's see, fat aversion, fat desire. You see here both in aversion and desire. That means what we saw with pulsatilla also. That means some of the patients that need arsenicum may have desire for fat. Some may have aversion to fat. So everything we see regarding fat is a symptom of arsenicum as well, of course, with other remedies. Okay. And we can also search arsenicum or a remedy, but let's see arsenicum now in a specific chapter. Let's see what kind of vertigo, let's say, does arsenicum have. Vertigo, so I write here vertigo, arsenicum. And now I see the symptoms that have vertigo, I mean from the chapter vertigo, remedy arsenicum. Vertigo in open air. Huh? Vertigo on closing eyes. There are stronger remedies here. You see arnica, chelidonium, lachesis, sepia, theridion. Okay, and now let's see theridion. Theridion, what is theridion? You just click here and you see the materia medica, huh? Theridion, GV notes, Berke, theridion is a spider, huh? Orange spider. GV notes here, you can see a page that Vithoulkas describes the remedy. Theridion has is sensitive to noise, has sleeplessness, dizziness. And you can also see it in, I don't know Russian, I wish I did, but you can see it also in Russian, huh? Russian. Etheridion. Also the repertoire, you can see it in Russian. Okay. So this is a repertoire, and I have also a case for you. It's not an easy case, but it is a case that in which the Vithoulkas Compass program helped me to find the remedy, because it was a remedy I didn't know of. It was many years ago in 2017, and there was this girl of 15 years old that has a severe dysmenorrhea, and I found the remedy with the help of Vithoulkas Compass, and I want to tell you this case. Do you want a case, or do you want me to continue with the repertoire? What do you prefer? You don't talk, you just listen. You can unmute the microphone and talk. What do you prefer?
The case.
The case, okay. Let's go with that case. So this is a girl of 15 years old that was brought by her mother because she had dysmenorrhea. That means that he had severe pains during her menstruation, during her period. So she's 15 and she has menstruating since she was 11 and a half years old. The menstrual cycle is steady, 20 days, and the flow lasts for 5 days. Okay. She suffers from pains that appear 3 days before menses and last until the first 3 days of menstruation. During the 4th day, she's better. So she has pain before the period, 3 days, and the first 3 days of her period. Very severe pain. The pain is so strong that she needs to take strong analgesics, painkillers. Every day she takes painkillers for 6 days, all the 6 days, 3 days before and 3 days during the period, the first 3 days. The pain is in the hypogastrium, in the back, lumbar region, and inner parts of thighs. Feels very weak, as if she had hypotension. All these days, she was to lie down in a fetal position. The pain in the back, in the lumbar region, is better if she pushes something like a wall or a piece of furniture with her hands. So she did this, was pushing something, because, and this was, with this, the pain in the back was somewhat better. Huh? She has frequent bowel movements, that means frequent stools, 3 times daily for 3 days, before menstruation. And after stool, she feels better. In the middle of the cycle, between menses, she has pain in the ovaries on one side, either right or left ovary. Until 1 year before, the pain was alternating between the one side and the other of the ovary. Like 1 hour on the one side pain, another side pain. But during the last year, the pain may successively on the same side. But this year, it does not have these alternations. She has some secretions from the her in between the menses, like leukorrhea. During these hard days, the 3 days before and the 3 days during menses, her mood is not good. She feels as if she's depressed. She cries more easily, and she's more irritable. As a person, she's neither chilly nor warm-blooded. This is a question that we do always, like if she feels towards the warm side or the cold side, because we have other remedies for if the person is very warm, we think of pulsatilla, we think of sulfur, we think of lachesis, and these remedies of this group. Or of course, if she's on the other side, if she is very cold, we think of, remedies that are cold: arsenicum, calcarea carbonica, rustox, nux vomica, remedies that are cold. So this is a question that we always ask, but this girl is neither chilly nor warm. She's normal according to the temperature. Her sleep is good. In her dreams, she usually sees a relative of hers that died because of cancer in the age of 15, 3 years ago. She was shocked about this loss. When she was visiting her in the hospital, she imagined herself in the same position. She usually sleeps on her abdomen. This is another question that we do, the position of the sleep. And we have remedies that sleep in a certain position. Like if the person sleeps in the abdomen, like here, one of the remedies that we think is medorinum. Medorinum sleeps on the abdomen. You see here, sleep position in the abdomen. You see medorinum, the only remedy in the 3rd degree on the abdomen. Where was I? She usually sleeps on the abdomen. She describes herself as sensitive, anxious, and irritable. She's very sympathetic. She may cry by seeing a little dog on TV. When she's angry, she has headaches. Her appetite is good. She tries to eat healthy. She tries to drink large quantities of water because she considers it to be good for her health. She likes meat, salt, spices. She does not like beans, aubergines, and fat. She's afraid of high places. She has a little fear of dark. She likes thunderstorms. She loves the sea. She rarely has fears that someone is behind her. I ask here about medorinum because, as we see, she had some symptoms, and the medorinum has a fear that someone is behind her, but she rarely has this fear. She does not like tight collars around her neck, and rarely she has aphtha in the mouth. So this is the case, and I did the repertorization. Let us see the rubrics here. Fear of high places. sadness, menses before, sadness, depression, menses during, sympathetic. And this is the degree. The degree means the intensity of the symptoms. And you can put here for 1 until 4. 4 you put very rarely, unless it is exceptionally strong. We usually use the first 3 degrees. Head pain, light, in general, from light, that means from strong light, he has headache. External throat clothing aggravates. This is the last symptom that she describes here. She does not like tight collars around her neck. So this is the symptom, external throat clothing aggravate. Abdomen pain, sore, bruise, tenderness, menses before. Dysmenorrhea, this is the stronger symptom that she has, painful menses. You see a lot of remedies here. Female pain, uterus, menses before. Pain, menses before. Lumbago, back pain, lumbar region, menses before, menses during, pressure ameliorates. Pain in thigh, this is one of the symptoms that she stressed, that the pain in the thigh is very strong before menses, and I put it in the 3rd degree. Position in the abdomen, the desires and aversions, and this is the case. So let us see what Vithoulkas Compass. Before, let's see the flat repertorization before see the solution. The flat repertorization, what does the flat repertorization do? It takes symptom by symptom and adds the symptoms that are covered by each remedy. You see here, sepia covers 15 of all the symptoms. We have here 22 symptoms, and sepia covers 15. Natrium muriaticum 14, phosphorus 14, pulsatilla 12, etc. And here the 29 is the addition of the degrees that we see in the repertoire. You see here, this symptom, sympathetic, is with 2 in natrium muriaticum, it is in 4 in phosphorus. Phosphorus is very sympathetic. And it adds all the degrees from each symptom, okay? About phosphorus, 26. And we see here, sepia, natrium muriaticum, phosphorus, pulsatilla, calcare. Let's see here now what the expert system proposes. Expert system not only takes into account the sum of the degrees in each case, but combines the rare symptoms of each case, like the brain of what does our teacher does. Like it combines the rare symptoms of each case and proposes remedies that may be not only because they have a lot of symptoms. So let me show you what I mean. Here we see pulsatilla that covers 12 of the 22. But here we see a remedy, viburnum opulus. It's a not so known remedy that covers only 6 of the 22 symptoms. but has some peculiar symptoms. If we see a remedy that we don't know, we go to the materia medica and see about this remedy. And that is what I did. I went to the materia medica and I saw that this remedy has the seat of its action in the female productive system. Female symptoms most important. Colicky pains in pelvic organs. And I saw here menses lasting for a few offensive, I saw a specific symptom here bearing down pains before menses. Let me find the symptom that strike me. Pain in the anterior muscles of thighs. I saw this symptom that it was a rare symptom and was very strong to this little girl. And on this symptom, and because the other remedy did not satisfy me. It was a not full picture of pulsatilla. He was not warm. It did not have the symptoms of pulsatilla that we would like to prescribe this remedy, not any other strong symptoms of a polycris remedy. And because of this symptom of the pain in the thighs, because of the intensity of this pain in the thighs, and because dysmenorrhea, although viburnum is a small remedy, it is in the third degree in this large rubric. So I decided, although I didn't know this remedy, I gave it a shot. I said, let's try this remedy, viburnum opulus. And I gave this remedy with the help of Vithoulkas Compass. Otherwise, I would not have thought of this remedy. Although you see here, it's not the first remedy, it's the second remedy. It does not mean that always we are going to do the repertorization and the first remedy is the correct. You have to think, to see, to match, to read the materia medica, to see if the materia medica fits the picture of the patient, and prescribe accordingly. Okay, so the program gave me the idea of viburnum. I read viburnum and I decided to give it, and it had a marvelous effect. So I saw her in 13 of October 2017. 13 of October. After about 2 weeks, she has her menstrual cycle, and the pains are a little better, 20% better. Also some headaches. Okay, let us wait. I gave viburnum 30 CH every day for 10 days. And after the next month, that is 1.5 months after the remedy, when the second cycle came also, this is the first cycle and then the second cycle, she's much better. Before, she used to take about 20 pills of painkillers in each menstruation. Like every day she was taking pills. The last time she took only 1 pill, although it was not needed. She took it to feel secure because she had to go to a social event. Now the pain lasts for just 1 day out of the 6 days that it lasts before, because she had pains 3 days before and 3 days during menses. And now she's normal. She has only pain 1 day. She has acne on her cheeks. We like the symptom. We like if we see after a prescription of the remedy, a deeper problem is better, and the skin problem is worse. Huh? She may not like it because she's a young girl and she does not like to see acne, but we like to see the acne because we know that it is in the correct direction of cure. It is what we say in homeopathy, the Hering's law, that the symptoms from the most severe organs go to the less severe organs. Also, she has less headaches, etc. So this was the case with the viburnum. There are also a lot of other features in Vithoulkas Compass. If you are interested, we can arrange also another session to talk about them. I guess that's it. If you have any more questions or if you want me to tell more about anything, I will be happy to do it. Or else, thank you that you have heard me. And I wish you all the best in homeopathy. It is homeopathy is difficult, but if you stay with it, if you study it along the guidance of our teacher, Professor George Vithoulkas, you'll see that you'll get satisfying results.
Thank you very much.
Okay, thank you.
Thank you very much. Have a good day.
Bye-bye.
Bye.